Good afternoon, everyone. And Today's our first class for minimally invasive cardiac surgery. This is the new fellowship that we've started, and I'll be taking the sessions. So I request you all to kindly be regular with the classes, to be actively participating in the classes, to make the most of them. And we'll soon start our in-person training as well. Myself, Dr. Shagun, I have recently relocated to the UK for my training in breast surgery. But yes, I've been trained in India my throughout my life, and I am in the UK for the time being, and I don't know till when. So today we'll be talking about history, patient selection, instrumentation, and the safety. We'll be comparing about open heart surgery and how minimally invasive cardiac surgery has come into picture and all the nuances around it. So by the end of this lecture, you should be able to understand the concept and evolution of minimally invasive cardiac surgery, identify the appropriate patient selection criteria, compare conventional open cardiac surgery with minimally invasive approaches, and recognize the essential cardiac operations performed through smaller incisions without full median sternotomy, because the entire thing is that you need to gain access to the heart. Now, conventionally, it's just open it up from the center and open up the rib cage, and heart is there for you beating. But the entire story starts from there itself. It is really, really painful to bring it back. To close it back, it is maximally invasive and yes, exposes the heart to the environment. So it is prone to infections. Patient is prone to atelectasis. They have to be ventilated, kept in the ICU for long times, have to be prescribed opiates, which are again respiratory depressants, because it's really, really painful to
Heart
join back
problems
the.
are rising rapidly in India, but fear of big surgery stops many people. Now there is a safer and advanced option. Introducing minimally invasive cardiac surgery, done through small cuts, not large openings. Less pain, less blood loss, faster recovery, and shorter hospital stay. Get back to your normal life quickly. Consult your cardiac specialist today. Choose advanced care. Choose a healthier heart. Heart problems are rising rapidly in India, but fear of big surgery stops many people. Now there is a safer and advanced option. Introducing minimally invasive cardiac
Form. But yes, it's always a good idea to learn about it while you're learning open surgery. Now, historical evolution of cardiac surgery, the key milestones would include in the 50s, open heart surgery using the cardiopulmonary bypass started happening around the 80s and the 90s. There were advances in imaging and instrumentation. And then in the 90s, the minimally invasive, just the valve surgery was introduced, where through the femoral catheter, you can do it through a catheter. That was minimally invasive, but only valve surgery. So, actually. Now about something about cardiopulmonary bypass, so it may be established through either femoral artery and vein cannulation or through the central cannulation in some few selected cases, and the perfusion management can be carefully coordinated between the surgeon, anesthesiologist, and the perfusionist, and this all goes around the heart-lung machine. If there's any doubt, any question, you can interrupt and ask at this point. It's not a very long class. Is this just too much during the operation? It will give you cervical issues. Happens with a lot of surgeons who don't take care of it in their 30s and 40s, and then they pay the price in their 50 by retiring early or not able to do the procedure, because in your 50s is when your practice will be booming. So you need to make sure for those 10 years you need to work in your 30s and your 40s to have your booming practice in your 50s.
Minimally invasive cardiac surgery is transforming heart care. But how does the heart keep working during surgery? That's where cardiopulmonary bypass comes in. In Mike's, small incisions replace traditional open surgery. The heart-lung machine takes over circulation and oxygenation. allowing surgeons to operate on a still and safe heart. Meanwhile, vital functions are carefully monitored. Once surgery is complete, the heart takes over again. Patients recover faster with minimal trauma. Mix with bypass. Safer, smaller, smarter heart surgery.